Hello, my name is Dr. Bob Devereaux. I'm a family practitioner in a small community in Southwest Virginia, and I'm a member of Physicians for a National Health Program. I've been practicing in this community for the last 34 years. During this time period, I feel like I've been on the front lines of providing primary care in an underserved community. I work at a rural health clinic, and it's been a really gratifying career, but I've unfortunately had too many situations where I've had to help patients that are having difficulty affording their care or affording medications. Um, I can remember many conversations over the years where I've had patients that have become disabled due to musculoskeletal problems, COPD, heart disease, had to quit their job. And although they might qualify for disability benefits, they've generally lost their health care coverage, lost their health insurance. And then at that point, trying to navigate getting them care. In some instances, I remember having difficulty scrambling to get patients oxygen because they had no health insurance. This was particularly a problem until last year when Virginia decided to allow Medicaid expansion to its residents. But prior to that time, we had a lot of desperate patients that just didn't have any health insurance at all. And this has gotten me very interested in single payer healthcare and how Medicare for All can help alleviate the crisis of healthcare that we see in rural areas. You know, in the course of researching this talk, I realized that rural America may not be a particularly safe place to live. There's really a high disease burden in non-metro areas. You know, we have a pretty unique demographic spread. Patients in rural areas tend to be older, poorer, less educated, more likely to smoke, more likely to be obese, less likely to exercise. 22% of rural residents live in families that are below the poverty line. So you combine those demographics with problems with access to care, limitations of insurance, underinsurance, and it results in a crisis of mortality. I mean, people in rural areas don't live as long as they do in the rest of the country. Studies show the difference is actually 3 years compared to metropolitan areas. And this mortality rate is due to excess deaths from heart disease, COPD, cancer, accidents, and strokes. In fact, accidents occur at a rate of 50% higher in rural areas. I often tell my patients that for their teenagers driving a rural area, it's actually, they're more likely to die in a traffic accident than they would be living in a city just because of the hazards of driving on rural highways. And this is often in areas where you don't have access to trauma care, so that contributes to the excessive death rate from accidents. It's more dangerous to be pregnant in a rural community. Maternal mortality is 50% higher in rural areas as compared to urban parts of the country. There's a similar spread when you're talking about infant mortality too. And this is due to the fact of, well, there's a number of factors, but lack of OB care, which is harder and harder to find hospitals that do obstetrics in rural areas. Currently in the US, only half of counties actually have OB care. Just to focus on this a little bit, in the state of Alabama in 1980, 80% of counties actually delivered babies still. There were hospitals doing OB care. Currently, that's only 30%. And hospital closures have contributed to this, other economic factors that cause OB docs not to locate in rural areas. But this is a problem. And it's not just medical care. Dental care suffers in the rural US. 1 out of 3 rural seniors don't have any natural teeth, and this is due to a lack of preventative care in their lifespan. Rural areas just don't have enough dentists, and the communities that do have dentists, the care is often unaffordable. Where I live, I'd say approximately 10 to 20% of the population goes to a dentist. Uh, the, the other 80% just don't have access. You know, we'll treat dental infections in the office, do the best we can. I give lip service to telling them, you know, you need to see a dentist, but I know that's just not an option for so many people. The uninsured population, that's a big problem in the US. As you may know, 28 to 30 million people in the US don't have health insurance. Even more of a burden in rural areas where 12% of rural residents don't have any insurance at all. And unlike urban areas where there might be other options for care for this population, such as a federally qualified community health center, or maybe a charity hospital or a free clinic, that infrastructure is often lacking in rural areas. There's just not enough people, geographies to spread out. So the uninsured problem is particularly hazardous to patients in rural areas. Availability of insurance is problematic because it's more expensive. You know, we have a system of health insurance that requires a profit to be made, and if you've got fewer lives to cover and an area where care is more expensive, premiums are going to be higher. And this is particularly a problem because in rural areas, people don't make as much money. It's median incomes are 25% lower than in urban areas. So you've got a real affordability problem with insurance. And this isn't just private insurance. Affordable Care Act plans and Medicare Advantage plans tend to be less available and more expensive. There's just fewer insurance companies that are willing to take on the risk of rural areas. And the ones that do provide plans tend to have higher premiums and copays, and the deductibles are higher. In fact, a study showed that Affordable Care Act plans in counties where there's only a single plan offered have 50% higher premiums than in the rest of the country. I'm in Southwest Virginia. We're near the border of West Virginia. In that state, 82% of the counties only have a single Affordable Care Act plan. So for many residents, it's just not an option to go with, you know, the ACA or Obamacare type plan. Limited access to care is a huge problem in rural America. This was highlighted in a report that was broadcast on NPR. 26% of rural residents just don't have access to care for a number of reasons. And this is despite the fact that currently 90% of, well, we saw about 87% of rural residents do have insurance, but they still can't get access. Because of the structure of health insurance, many plans have limited networks. It's one thing to be in an urban area where your network requires you to drive an extra mile or two to get to a hospital or a physician in your network. In a rural area, it might mean driving 30, 40, 50 miles to access your network. We see that in our community. There are residents of our area that work in a business that's in another state, and their health care network may be in that other state. So they can't go to our local hospital. They have to drive 40 miles to another hospital for care or physicians. A real problem. Office hours for physicians and maybe more limited in rural areas. You know, you don't tend to have the urgent care centers and easy access to care like you might be have in a more populated area. You know, the geography works against people in rural America. You know, you're talking about an area of 80% of the landmass of the country with only 15% of the population. And if you have economic reasons not to build clinics, not to have hospitals stay open, you know, location gets to be more and more an issue as people have to drive farther to access care. And then the big reason, of course, the affordability issue, primarily due to people being underinsured. They have coverage, but there's skyrocketing deductibles, copays, coinsurance, just prevent them from accessing care. Rural hospitals are closing across the country. This has been a trend for the last several years. 166 have closed since 2005, as you can see in the slide. And this is a trend that's continuing. 19 hospitals closed in 2019. In recent years, the vast majority of these closures have occurred in states that have declined to expand Medicaid to their residents. You know, when this happens in a community that already has lower incomes, you know, you suddenly have a big chunk of the population that has no insurance options. And this has often been the case in large agricultural states in the center of the country. It's kind of disturbing to me to see that states that often have suspect view of the federal government and have decided not to allow Medicaid to be expanded to their residents often have the biggest burden of people living in rural areas that, as a consequence, lose their hospitals and lose more access to care. And you know, this trend of hospital closures isn't over. 1 out of 3 current rural hospitals are in danger of closing due to a negative balance sheet. And if a hospital closes in a rural area, the doctors often go with it. I mean, I've seen this in our region when a hospital closes. They especially lose specialists, but also primary care docs tend to locate elsewhere because you don't have the infrastructure to support them. You know, the problem is the way we finance healthcare in this country. The status quo is just not working. It's not able to support these hospitals, especially in states that have not allowed Medicaid expansion. The only solution to providing a stable funding source for rural hospitals is Medicare for all. In that case, all the residents of rural areas are covered, so everybody can contribute to the finances of that hospital. And also with the Medicare for all plans that have been proposed in Congress, they tend to use global budgets as a means to finance the hospitals. So this means a hospital wouldn't be so dependent on volume or a certain payer mix. Now, if they had a particular need, like in our part of the country, the opioid epidemic is still a major challenge. Hospitals could have a line item for this. You know, we need extra money for treatment for this. You know, it was the case last year. We need to keep that going. In a for-profit system, you're not able to cover your local needs because a profit always has to be made. When you lose your hospitals, you tend to lose your primary care doctors. And when that happens, you're going to have less preventative care. And studies bear this out, that rural communities tend to offer less preventative screening. Less lifestyle advice is given. There's fewer well child visits, fewer cancer screenings, including for colon cancer, pap smears, and mammograms. You don't have a local rural hospital. You know, where do the patients go for their mammograms? Where do they go for colonoscopy? A lot of this is contributed by the lack of primary care docs. In urban areas, there's 79 per 100,000, 79 primary care docs per 100,000 population, only 55 per 100,000. So about 2/3 the number of docs in rural areas. The discrepancy is even more exaggerated when it comes to specialists. Only 30 specialists per 100,000 in rural areas versus 233 in urban areas. The physician shortage means that you got a doc in a rural area who is just putting out fires. They're dealing with crises. They're transferring patients out elsewhere. They don't have the time to effectively manage a panel of patients where they can do real prevention. And that's, like we saw earlier from the demographics, that's really what's needed in these communities. They have lifestyle problems. They have increased rates of poverty. They need the preventative services. And in the current way healthcare is provided, you don't have the economic support for that. We've already talked about the problem of uninsured, and there are proposals out there for, well, let's just expand the ACA. Let's let certain people buy into Medicare, also known as a public option. But as we've seen, this isn't an economically viable option in rural areas. Due to the economies of scale, these plans wouldn't necessarily be low cost. You're still going to have the problem of high premiums, high coinsurance deductibles that keep people from accessing care. On the other hand, Medicare for All provides seamless lifelong coverage for everybody. Doesn't matter whether they're working or not, what kind of job they have, or where they live. This would bring some equity to care provided in rural areas. I mean, in rural areas, we don't say, well, because you live in the country, we're not going to provide mail service. Or, your kids just can't go to elementary school because there just aren't enough people living in your community. And we don't say, well, we're not going to maintain the roads because just not enough people travel them. I mean, we've decided as a society, these kind of services are just as important for rural residents as they are for those who live in cities. Why is healthcare any different? For the economic reasons, the underinsurance problem is a particular difficulty in rural areas. Median income is 25% compared to the rest of the country. And because of that, a public option type plan where you're still going to have the problem with copays, deductibles, etc., it's just going to be less affordable to residents in the rural areas. Public option plans are going to tend to have there's no reason to think they wouldn't have restrictive networks. And these are really burdensome. People don't want to have to drive 30, 40, 50 miles to access a hospital or doctor. Whereas with Medicare for All, that burden would be lifted. I have patients currently that have to drive 40 miles to a CVS drugstore because that's the only location their insurer will allow them to get prescriptions filled. So we already talked about the burden of treatable illness in rural communities. Public option is really not going to be the answer. Again, you've had the problem with access to care because of these plans have a history of being unaffordable for patients. Medicare for All, though, would guarantee care for everybody, and the preventative services that are so needed in rural area. We've talked about this disease burden: heart disease, COPD, cancer, mental illness, suicides, drug addiction. And despite expansion of insurance coverage in rural areas, I mean, this hasn't been the answer. The statistics bear this out. We need a change in how insurance is funded in this country. And this leads to real problems. I mean, a study showed that mortality rates in the rural area were 23% higher, preventable hospitalization rates 40% higher. The study that looked at this correlated these excess rates to lack of primary care docs and specialists. You could actually go community to community, look at the number of doctors, primary care and specialists, and correlate it directly with mortality rates and hospitalization rates in any given hospital. So what's the solution to hospital closures? We need more reliable funding through global budgets as provided by Medicare for All. This would bring stability to the financing. If everybody's covered in a rural community, these hospitals and clinics have a better shot at staying in business. The current system is based on having to make a profit. Many healthcare systems have expanded into rural areas over the last several years. If you've got a rural hospital that's not contributing to the profitability of that system, the bean counters take a look and say, hey, maybe we're better off closing that facility, shifting care to a more central location. That's great for the bottom line. It tends to support the specialty services in the bigger areas, but it doesn't deliver the care people need. And it contributes to this suffering and excess mortality in the rural areas. So to sum up, why do we need single payer Medicare for all? Well, we've already seen that we can have an impact on this difference between life expectancy and morbidity in rural areas by providing more health care. So we can protect more rural lives if we can expand coverage. And hospitals that are central to providing care in the community are going to have more reliable funding instead of a mix of Medicaid, private insurance, Medicare. Everybody's going to be covered the same, and through global budgets, the hospitals can get a stable source of income. And these hospitals are really essential to the rural communities in other ways. They're often a big employer. Businesses that may decide to locate to a rural area, they're going to want to have a hospital, and they're going to want to know what the quality of care is in that community, and having a hospital there to help coordinate care, be part of a referral network is important to them. So in summary, rural America composes an important part of our history and heritage. Its residents deserve no less than the best healthcare we can provide. It's been a pleasure doing this talk. I think we have time for to look at some questions that were submitted to me. First one is, can Medicare for All do anything to address the physician shortage in rural America? Well, I think this is, again, just economics. You know, if everybody's covered in a community, if you have a guarantee of getting payment, rural health clinics, and even freestanding practices are going to be more likely to go forward and be supported. Economics is just what tends to prevent docs from locating to rural areas. And also, rural hospitals that are supported by a global budget are going to be in a stronger financial situation and able to aid in their recruiting process and get docs to rural areas. If you don't have a hospital, you're not going to have specialists, and specialists are also, as we see, important to lower the rates of hospitalization and even lower mortality rates. Someone else submitted the question that rural America is not a monolith. How would Medicare for All address different types of rural communities? And that's absolutely right. rural communities could be a bedroom community, could be a very sparsely populated agricultural area, could be an area with a strong Native American community. Uh, I think having a hospital open with a global budget can really look at what do we need to do for our community to improve services? What's our local need? And that's a better way to coordinate care, get the resources where they're needed, than a profit-driven system that just looks at, okay, how much money can we make from this community? It doesn't look like much, so let's pull out and force these folks to drive somewhere else. And we know when you've got geography limiting people accessing care, they're oftentimes just not going to get the care. Another question would how would Medicare for All benefit farmers, seasonal workers, and people in rural America who are self-employed? Well, this is pretty apparent that if everybody's covered cradle to grave, it just frees up a lot of the economic insecurities about starting a business. I mean, how can you start a small business if you got to worry about providing health care for all your employees? Who's going to have a startup when maybe one of the owners has to work a second job in order to have health insurance for their family? So it just opens up possibilities for economic development. I mean, rural hospitals by themselves are an economic engine. But somebody maybe wants to open a coffee shop on Main Street, or work on a small, provide a new agricultural business. In our part of the country, there's renewed interest in organic farming and the farm to table movement. But starting up a small business like that and having to worry about how we're going to pay $15,000, $20,000 in insurance premiums for a family, it's a big anxiety, a big stress, and something that would tend to cause people not to start a business. Of course, seasonal workers, getting them coverage, seasonal workers that are often undocumented still need health care, and they still get sick, and they place a burden on the local hospital when there's no insurance revenues coming in. So if any resident of the US was provided health care coverage, that again provides more stability to clinics and hospitals in rural areas. Last question is, how would Medicare for All benefit communities that are experiencing population loss? Well, there's a number of reasons these communities are losing people, some of which can be reversed, some can't. But even if communities are losing population, if you still have coverage and you can still go somewhere for care, that kind of allays a lot of the anxiety of the community. So even if an employer moves out of the community, or an insurance carrier would decide it's not profitable to provide plans in that area, there's a guarantee of coverage. And also, like I've alluded to, if everybody's covered, that's got to help stimulate the healthcare infrastructure. You got more stable financing. It just takes that whole healthcare financing issue out of the equation, and rural communities are going to be in a stronger position to be able to stimulate their own economies through new businesses. So I hope I was able to relay some useful information on this really important topic of rural healthcare. This has been really important to my career, and I think a lot of the difficulties I face day to day taking care of patients and being part of my community would be alleviated if everybody was covered. Everybody in, nobody left out. Thank you very much.